My charge is to get people to think about things that they would otherwise not think about had it not been brought to their attention. I mean, doctors are telling me, oh yeah, our system is horrible. Nurses are saying, oh my gosh, this is horrible. And even the insurance company was like, hey, yeah, the system is actually really horrible. I'm like, well, with all these people saying it's horrible that are actually in this profession, why is it so complicated to get fixed? One of my first initiatives for healthcare reform is something I call less than 20, more than 5. And you go, well, that doesn't make sense. Well, when I explain it to you, I think it will. When you go to a scheduled doctor's appointment, you spend less than 20 minutes waiting before you actually see the doctor, and then you see the doctor for more than 5 minutes. Prior to having this diagnosis, where I would go to a doctor's office and sit and wait 20 minutes before I've even had the intake. And that's where they take you in, they do your blood pressure, they take your temperature, they get your weight, they get your height, and then they sit you in a room for another 20 to 25 minutes. So now you've been there for 45 minutes. And I'm like, okay, and mind you, this didn't bother me because this is what I was used to. The doctor comes in, asks you what's wrong, you spend a couple of minutes explaining, and then the doctor says, well, let me run some lab work on you. At the same time, they're typing in their computer, which is called charting, and then he says, okay, you're gonna do these labs, and then I'll call you back within a week once your labs are done. If I can get 25 million people to agree that this is a problem that, you know, it's just setting an expectation that was never there. If I don't do this now, somebody who I really care about who's healthy is gonna go through this as well. Even though you may be healthy, somebody you love and is near and dear to you may not be healthy. And your first thought should be, what if this was me? And just that one little change is gonna improve the quality of people's lives. And if they get to spend more than 5 minutes with their doctor, they're probably gonna have to learn and get exposed to more information that they would normally not be exposed to.
The only thing that can keep you from getting better is yourself. And that's something I believe in to my core. I also believe that our healthcare system needs to be totally improved upon. So if you can resonate with this message, I ask you to take a deep, hard look and say, do you want things to stay the same or do you want things to change? That's what I'm here to do. I'm here to bring change, and change that everybody benefits from, not just me. Thank you so much.